Hello guys, today in this lecture we are talking about antifungal drugs. Today we will be looking at what drugs are classified as antifungals, what are their mechanism of actions, and what are the important side effects. So, in this lecture we will be understanding the pharmacological basis for therapeutic use and adverse effects of the drugs which target the fungal cell membrane. It is an important point to consider that most drugs which are antifungals are targeting the components of fungal cell wall. Their drug mechanisms are varied. Some drugs bind to the ergosterol, which we will be understanding further in the lecture. Some are the inhibitors of enzymes. Then, further in the lecture, we will be looking at the treatment of Cryptococcus meningitis, which is a fatal infection and especially common in immunocompromised individuals. In the fourth and final part of the lecture, we will be looking at the treatment of aspergillus, which is also an important fungus. Some important drugs that we will cover today in the session are as follows. You can have a read. Now, let's talk about the fungal cell wall. Fungal cell wall has the following components. Number 1, ergosterol. Ergosterol is a sterol in cell membrane of protozoa and fungal species. It can be compared to cholesterol in humans. It is an important drug target because many species cannot survive without it. Number 2, we have beta-glucans. Beta-glucans are naturally occurring glucose polymers that are present in abundance in plants, bacteria, and fungi. Beta-1,3-glucan is the backbone, and beta-1,6 is seen coming off beta-1,3. Finally, we have chitin. Chitin is a polymer of N-acetyl glucosamine, which is derived of glucose. It is the primary component of the fungal cell wall. Both chitin and beta-glucans are immunogenic. This means that the body's immune system can recognize these special particles and consider them to be foreign. This acts as a host defense mechanism. Further, we have 1,3-beta-glucan synthase. It's also an enzyme which is responsible for the synthesis of beta-glucan. In this slide, you have a further opportunity to have a look at all the components that we discussed: chitin, ergosterol, beta-1,3-glucan, and the glucans. Now let us have a look at the drugs. So these are the drug targets. If we look at ergosterol, which we just discussed in the previous slide, that it is just like cholesterol in human beings and it is an important drug target, a drug called amphotericin B targets ergosterol binding. That means amphotericin B binds to ergosterol and causes its effects. When we talk about ergosterol synthesis, there are certain inhibitors of enzymes such as imidazoles and triazoles, which inhibit enzyme called lanosterol alpha demethylase. These enzymes are important for the synthesis of ergosterol. There is another class which can block the synthesis of ergosterol. This is the inhibitor of scoline epoxide. Drug which belongs to this class is terbinafine. Then, in the third class of drugs we will be talking about today are the inhibitors of echinocandins. These include caspofungin, enidulafungin, and micafungin. So in this slide we have all we need to know about amphotericin B. Amphotericin B is an important drug. It is derived from Streptomyces nodosus in 1956 and is one of the first antifungal drugs to be used. Historically, it is important, but it's still widely used for certain difficult infections. We use it IV infusion daily, and it was the first systemic antifungal agent. It has a funny story. Its nickname is amphoterrible. This is because it has a side effect profile which is absolutely terrible. The mechanism of action of amphotericin is that it forms cation pores for potassium efflux by binding to ergosterol. This leads to leaking of potassium and monovalent ions such as sodium and chloride. This leads to cell death. Amphotericin is used to treat systemic fungal infections such as cryptococcal meningitis. It is important to consider the importance of amphotericin being able to cross blood-brain barrier, as we know that cryptococcus meningitis would involve the meninges, which cover the brain and the spinal cord. An inflammation will cause meningitis. This inflammation is usually due to infection in the cerebrospinal fluid near the meninges. For the treatment of a cryptococcal meningitis case, it is important that the drug we are using is able to cross the blood-brain barrier. Talking about the adverse effects of amphotericin B are that they have two different kinds of effects, acute and chronic. A few acute effects are classified as bake and shake. That means that you can have fever and chills due to pro-inflammatory cytokine release. When we talk about chronic causes of adverse effects, we see that the patient can develop organ failure, especially kidney, as it causes damage to the distal tubule and causes acute renal failure. There is a concept of using unilaminar liposomes to deliver amphotericin. Unilaminar liposomes are extremely lipophilic. That means that they are more fat soluble than water soluble. That also means that they can reduce its excretion from the kidney and be less toxic. In this diagram, you can see that ions can leak through the membrane when amphotericin is binding to ergosterol. This will cause potassium flux and cell death. In this image, you can see that there is a diagram for unilaminar liposome. It is a mixture of fat-soluble and water-soluble agents arranged in a specific manner. It is important to note that unilaminar liposomes reduce kidney toxicity or nephrotoxicity, which is the chronic side effect of amphotericin B. Let us talk about another drug, which is commonly used with amphotericin. It is called flucytosine. Flucytosine is a prodrug. A prodrug is a substance that is administered and is metabolized, and then it is converted within the body into a pharmacologically active drug. When it is pharmacologically converted by the fungal cell by an enzyme which is only found in fungus called cytodeaminase, when it is converted, it becomes 5-fluorouracil. 5-fluorouracil is inhibiting the fungal cell proliferation, so it acts in synergy with amphotericin B. Flucytosine converts into 5-fluorouracil, as we just said. 5-fluorouracil is an antimetabolite. Now, an antimetabolite is a substance that interferes with the normal metabolic processes within cells, typically by combining with enzymes. In this case, that enzyme which this antimetabolite binds to is thymidylate synthetase. So what flucytosine is able to do is that its active product gets incorporated into the RNA and then reduces DNA synthesis. It is commonly used to treat candida infections and cryptococcus infections. A good way to remember how amphotericin and flucytosine work is that flucytosine needs to get into the DNA to work, and amphotericin is able to punch those holes for the better penetration of 5-flucytosine. One of the adverse effects of flucytosine is bone marrow suppression. This means that the bone marrow will no longer be able to produce the immune cells. This will lead to reduced immunity. Now let us talk about inhibitors of ergosterol synthesis. So, ergosterol, which is the component of the cell wall, as we said before, the cholesterol analog, is produced through a varied reaction. So, squalene produces lanosterol by the means of squalene epoxide, which is an enzyme. Lanosterol gets converted into ergosterol through lanosterol alpha demethylase. Both of these enzymes are important for ergosterol synthesis. If we inhibit the enzymes, then ergosterol will not be able to get synthesized. In the first class of the drug, we will be talking about imidazoles. Imidazole, namely clotrimazole and miconazole, treats vulvovaginal thrush through the use of pessary and cream. They can treat skin infections known as dermatophyses, which are fungal in cause, such as ringworms, athlete's foot, and patients normally need to treat for 2 weeks after the infection has disappeared to prevent relapse. In theory, clotrimazole and miconazole can be used to treat nail and scalp infection, but due to their topical use, the penetration of the drug is not so good. So there are other agents which we will be talking about in this lecture that can be used to treat nail and scalp infection, so keep a note of this. Moving on, let's talk about ketoconazole. It is also an imidazole. An imidazole is a drug which will inhibit lanosterol alpha demethylase, which is the second step of ergosterol synthesis. Ketoconazole was first used as an oral agent to treat systemic fungal infections, but it is not anymore used because of its rare but fatal side effect which it causes to the liver. It can cause liver toxicity and result in death. This is because lanosterol alpha demethylase is an enzyme in humans as well. It is a liver cytochrome enzyme, and these enzymes are responsible for influencing various functions of the liver. So now, the new guidance suggests that ketoconazole should be used as a topical agent only, along with its counterparts clotrimazole and miconazole. And another important class of drugs are triazoles. Triazoles are also the inhibitors of lanosterol alpha demethylase. They are only different in structure from their previous generation imidazole. That means triazoles are newer agents which are inhibitors of the second step of the ergosterol synthesis. One of the important agents is fluconazole. Fluconazole, discovered in 1988, is an oral and IV formulation. It crosses the blood-brain barrier. This means that it can be used to treat meningitis, which is caused due to fungus, namely Cryptococcus meningitis. We have already discussed a drug which also treats Cryptococcus meningitis. It is called amphotericin B. This will be useful when we talk in detail about the treatment of Cryptococcus meningitis. Anyway, fluconazole treats oral candidiasis of oropharynx and esophageal. It is the second line treatment for Cryptococcus meningitis. It is not effective against aspergillus. This is also important to know. The adverse effects of fluconazole also includes liver interactions. Moving on, let's talk about other drugs in this class. Itraconazole is an oral and IV formulation. It is a broader spectrum drug than fluconazole. It has no CNS penetration. That means it has no use in meningitis. However, it is a drug which is effective against aspergillus, especially in TB and COPD patients. An important adverse effect to remember is heart failure. Itraconazole can cause heart failure. The third drug of the triazole class is posaconazole. Posaconazole is an important drug which can be used to treat invasive fungal infections which in patients intolerant or resistant to amphotericin and fluconazole. Lastly, voriconazole is the last triazole we will be talking about. It is the drug of choice in treating aspergillosis. Aspergillosis, the disease caused by aspergillus. The adverse effects of voriconazole includes visual disturbances. These occur amongst 30% of the patients. They can have blurred vision and increased light sensitivity. So, we have covered most of the fungal drugs. This is the right time to talk about the treatment for cryptococcal meningitis. The meninges are 3 membranes of the brain. I can show you that. So there are 3 different membranes in the brain. Inflammation of these due to infection of fluid surrounding the membranes is called meningitis. This could be viral, bacterial, or fungal. The fungal one is called cryptococcal meningitis. The symptoms of cryptococcal meningitis include headache, nausea, vomiting, lethargy, and sensitivity to light. Some other symptoms include stiff neck and fever. It is important to diagnose because, if left untreated, it can result in brain damage, coma, hearing loss, hydrocephalus, and is fatal. Up to 30% of HIV-related Cryptococcus meningitis die from the illness. So that means we understand two different things from this, that Cryptococcus meningitis is a fatal disease and that it affects more people who are immunocompromised, such as people with HIV/AIDS. Now let us talk about the pharmacology of Cryptococcus meningitis. You can treat cryptococcal meningitis with IV amphotericin and flucytosine. Both of these drugs we have talked about before in this session. Amphotericin B is an ergosterol binder and flucytosine is an antimetabolite. Then, it is important to consider the second line of treatment for cryptococcal meningitis. Once the spinal fluid is negative, the patient is switched to fluconazole. This drug we have just mentioned is a ergosterol synthesis inhibitor. It inhibits the second step of ergosterol synthesis, namely the lanosterol alpha demethylase. Fluconazole treatment is continued for 8 weeks, moving to fluconazole treatment 200 milligrams from 400 milligrams previously. This is continued indefinitely to prevent relapse, especially in HIV patients. An important aspect to consider in HIV infections is that if you have a patient with recent diagnosis of HIV, you should delay antiretroviral therapy to treat fungal infections. So you need to treat fungal infections first, and then you can move to antiviral therapy. This is partially because fungal, antifungals, and antiretroviral therapies cannot be given at the same time, because both of them can interact as they affect the liver enzymes. Let us now talk about aspergillosis. Aspergillosis is recognized as a fungal ball. It colonizes a healed lung scar or abscess. Diseases such as TB and COPD patients are more affected with aspergillosis. The drug of choice for aspergillosis would be voriconazole, which is also an inhibitor of lanosterol alpha demethylase. You can use itraconazole for patients with TB and COPD. Lastly, posaconazole is used for invasive fungal infections. An important aspect to consider for aspergillosis is that fluconazole is not effective. Let's talk about terbinafine now. Terbinafine is another drug which inhibits ergosterol synthesis. However, it is not this enzyme this time. It is the first enzyme which is inhibited. Terbinafine is an inhibitor of the first enzyme in the synthesis of ergosterol. It prevents synthesis of lanosterol from squalene by inhibiting squalene epoxide. It is hydrophobic and thereby it accumulates in skin, hair, nails, and fat. For nail infections, you would have to give terbinafine as an oral dosing. Let's talk about adverse effects of terbinafine. Terbinafine mainly causes adverse effects due to long duration of treatment. This is because treatment is continued more than 8 weeks. Adverse effects include diarrhea, headache, cough, and elevated liver enzymes. I hope you have recognized a pattern here. Antifungal drugs are known to inhibit liver enzymes or elevate liver enzymes. Terbinafine can also be used as for dermatophyte infections, including ringworms and nails. It is also effective for jock itch, which is a rash on the skin, and athlete's foot. Last drug today we will be talking about is echinocandins. Echinocandins is a drug which inhibits 1,3-glucan synthetase. If we look at the diagram again from the beginning, we talked about something called glucan. Glucans are important structures of the cell membrane and are synthesized by 1,3-glucan synthetase. And these glucans have a role in cell wall integrity. Therefore, if we inhibit the synthesis of beta-glucans, we can inhibit the cell wall formation, and thereby we can cause fungal cell death. Caspofungin is the important drug that we use as an echinocandin. We already discussed that it is an inhibitor of 1,3-glucan synthetase. It is given as an IV infusion. It treats aspergillus and candida infections and is not effective in CNS. I hope you have recognized another pattern here. CNS infections are referred to as meningitis here. That means that drugs which can penetrate blood-brain barrier or can penetrate CNS, one and the same thing, are used for the treatment of meningitis. Echinocandins can be used to treat resistant strains which are to the drugs such as amphotericin B and voriconazole. Echinocandins are able to treat serious fungal infections in immunocompromised patients. Two more drugs which are echinocandins are enidulafungin and micafungin. It is important to know that they do not treat aspergillosis. So guys, now we are gonna quickly discuss what we studied today. We talked about amphotericin B. Amphotericin B is an ergosterol binder. It forms a cation pore, causes cell death. It has adverse effects which are bake and shake due to procytokine release, which is fever and shaking. You have nephrotoxic effects, which are chronic effects to the distal tubule of the nephron. It is used in the first-line treatment for cryptococcal meningitis. Along with amphotericin B, you should always remember flucytosine. Flucytosine, a prodrug, is activated into 5-fluorouracil. It is an antimetabolite. It inhibits thymidylate synthase and reduces fungal DNA synthesis. It is synergic with amphotericin. One of the side effects of antifungal drugs, flucytosine, is bone marrow depression. Now we move on to imidazoles. These drugs are clotrimazole, miconazole, and ketoconazole. These are the inhibitors of second step in ergosterol synthesis, which is the enzyme lanosterol alpha demethylase. These are used as topical agents to treat vulvovaginal thrush, dermatophysis, nail and scalp infections. Ketoconazole is no longer used as an oral dosing because of its fatal but rare toxic effect to the liver. The second class is triazoles. These are inhibitors of the second step as well, but newer and slightly different in structure. These include drugs such as fluconazole, itraconazole, voriconazole, and posaconazole. Fluconazole includes the second-line treatment for meningitis because it is able to cross blood-brain barrier. Other treat aspergillosis. The choice is voriconazole number 1, which causes visual side effects. Posaconazole treats invasive infections, and adverse effects of itraconazole is that it can cause heart failure. Finally, we have the last two drugs. Terbinafine is the first step inhibitor of synthesis of ergosterol. It is highly lipophilic and treats nail, hair, skin, and jaw itch infections. Caspofungin is an echinocandin which inhibits 1,3-glucan synthase, which is responsible for the synthesis of beta-glucans. It treats aspergillosis and candidiasis. Other class drugs such as